Coming up, we'll be on location in Washington, D.C., discussing the latest advances in sinus treatment and how they can help relieve the discomfort associated with sinus problems that many people suffer with one of this region's top ENT doctors, Dr. Stephen Wall. Dr. Wall received his medical degree from the University of Pennsylvania School of Medicine and completed his fellowship training from the University of Toronto School of Medicine. Dr. Wall is widely recognized as one of this region's top doctors. Welcome, Dr. Wall. It's a pleasure having you on our program.
Well, thank you very much. I'm very glad I have the opportunity to talk to you today.
It's your first time, in fact, on the Top Doctors interviews. We've got a lot to talk about, Dr. Wall. We've got a couple of patients that are going to be joining us a bit later as well. But I wanted to begin, if I may, by having you please tell us what the balloon sinuplasty procedure is and how it can help so many folks.
Well, the balloon sinuplasty represents the next generation in treatment options that we have for patients who have either recurrent sinus infections or frequent sinus infections.
Can you please elaborate a bit more on the types of problems it addresses?
Well, one thing it's important to note is that problems and issues with the sinuses and the nasal passages represent a very frequent cause of patients going to see a doctor. And when we have a patient come in, we try to tease apart whether or not they have a short-term reversible problem or whether or not it represents part of a process which was a long-term issue or what we call a fixed obstruction. So let me give you an example. Let's say someone gets hit in the nose playing ball when they're younger. They might get a deviation inside their nose. That's going to represent a fixed issue. It may or may not require surgery, but it's certainly not going to just get better with nasal sprays. Now, contrast that with the patient who's miserable every April because they have allergy issues. That person might benefit from nasal sprays, an antihistamine tablet, saltwater irrigation, or even allergy treatment. Now, our office offers these types of options, but there's a subgroup of patients who have a significant anatomy issue. And in those patients, they might need a surgery to correct a problem. And within that subset, there might be a patient who would benefit from the balloon procedure.
And speaking of this procedure, can you please tell us how it's performed and what's involved? What are we looking at, Dr. Wall?
Sure. It's an evolution of a way we treat the sinuses. And the sinuses are hollow areas that we have in our face. They're in the forehead, they're in the cheek, they're between the eyes, and they go back as far as the middle of your head. So some patients will present with chronic migraine headaches, and it's actually a sinus issue. What most people don't understand is that the sinuses produce a lot of fluid. And that fluid is meant to humidify the air that you breathe in and help to wash away dust, dirt, and pollen. The problem you run into is that the sides of the sinuses can be quite large. The ones in your cheek are about as big as a ping pong ball. But the opening through which fluid drains is only as big as the tip of a pen. And so any little bit of congestion caused by a virus or an allergy can close off the opening, and that allows fluid to sit in place. And when that happens, the ordinary bacteria will overgrow. Everybody has bacteria in your nose. Everybody has bacteria in the mouth. Your mouth is not infected. Your mouth is colonized. You can brush your teeth every day, but you still got to brush your teeth tomorrow. You can never sterilize the mouth, and you can never sterilize the nose. As long as you make that fluid every day, the nose cleans itself. But if the fluid can't escape, then that ordinary bacteria will overgrow. And so most sinus infections are actually due to overgrowth of the bacteria that's always present at a low level.
Very interesting.
And so what we need to try to identify is whether or not it's a seasonal issue. So if you only get a sinus infection in April, then that person is best served by addressing their allergy concerns. If a person has infections throughout the year, or if every time they get an infection, it lasts for weeks at a time despite antibiotics, then that person might have an anatomic issue. Okay. And the way we would then evaluate that person is by getting a type of x-ray called a CT scan. And a CT scan is done as a series of slices. It's almost like looking at a loaf of bread. You take a slice and move back sequentially. And it allows you to see inside the sinus cavities to areas that you can't see by just inspecting a person. And so, for example, features we would look at would be the septum, which is what separates the left and right nasal passages. Many people have a curve in your septum. It doesn't necessarily need surgery. Other structures that are very important are structures called turbinates. Okay. These are structures inside the nose that regulate airflow. And it's a spongy tissue that expands and contracts. If you ever lay down and take a nap, sometimes you wake up and you're all stopped up on one side or the other. That's normal. It's also normal for the swelling to go back and forth. It shouldn't be swollen all the time. So when we look at an x-ray, if we see something abnormal, that is potentially something that could need surgery. For example, for someone who might have sleep apnea, who doesn't breathe at all through the nose. But a CT scan really is the next step in the process to see whether they're a candidate for surgery. And then if they are a candidate, we have to decide, are they going to have the traditional approach, or are they going to have the newer approach with the balloon?
And speaking of that, what is involved or entailed with that particular treatment as far as what the patient is looking at?
Well, the focus of the traditional surgery is to enlarge the natural openings so that fluid can escape the sinuses and so that the sinuses can ventilate. And with the traditional surgery, the person's asleep, and we use instruments to cut away pieces of bone, and we enlarge the natural opening about 20-fold. And if that's done, the person can then drain and get fewer infections. Over the past 20 years, we've had an evolution in the equipment that's available, and we now have fiber optic light sources and video screens and cameras that allow us to see inside areas that we didn't have access to before. And that's allowed us to have a much safer procedure, a much more rapid procedure, and therefore a much more rapid recovery. And as that's happened, we're able to transition more of the things we do to the operating room, from the operating room to the office setting. And with the balloon, that's sort of, again, the next level, because what we do is we adopt a method that was used for cardiac procedures, where you introduce a balloon, you expand an area where there's a narrowing. What we can do is use a little wire and thread that into the sinus opening, expand the balloon, and make it much wider. It makes the opening about 5 or 10 times larger. In addition, we're able to irrigate out the sinus with an antibiotic solution at the time of the procedure. And then when we withdraw the balloon, the opening remains enlarged. And for many patients who don't have severe anatomy issues, that approach is adequate to allow them to then get over that infection and to reduce the number of the infections they have moving forward.
That's certainly great to know, and all through the advancements in technology, right, Dr. Wall?
Well, advancements in technology, and also just some of the medications that are now available. We can have a patient come in, we give them a tablet to help make them relaxed, and a pain medication. We take some cotton balls that have an anesthetic solution. We put that into the nose for about 15 or 20 minutes. And when that's removed, the surface is very numb, the patient is relaxed, and we're able to do things in the office setting with the patient awake. They can communicate with us. They can tell if they're having, tell us if they're having any discomfort. And so the patient is more relaxed and not necessarily as apprehensive as they might be if they were going to a hospital setting.
Yes, and the balloon sinuplasty procedure that you just described a few moments ago certainly sounds like a great alternative to the traditional surgery options that have always been there. But it depends, as you mentioned as well, on the patient if they're a good candidate or not for that specific treatment.
Correct. Clearly it's an alternative and it's an option. Not every patient is a candidate for the balloon sinus procedure, but those that are can anticipate having a sort of a shorter recovery period because there's less tissue injury during the procedure. But certainly for patients that have more severe issues like nasal polyps or sleep apnea or other kinds of issues within the sinus cavity, the safest approach is to have them asleep in the hospital setting.
Is the balloon sinuplasty performed at your office, or does it require one that be at the hospital?
Well, the balloon sinuplasty, actually the technology was introduced into the hospital setting probably 6, 7, 8 years ago. And it still is available for use in the hospital. And for many patients, it is still something that is of benefit for them. But for the patient who may not have the same either serious medical issues that require that they be hospitalized, or if they really have a very focused area where there is an issue, then the balloon is preferable because the patient's operative time is shorter. You're in the office for an hour and a half for the procedure. You go home the same day. They tend to have very little discomfort. They tend to miss very little time at work, which for people is an important issue. Some of the costs analysis, which is not, of course, the primary reason we would recommend one procedure over another, but without the cost of the hospital fees, many patients' out-of-pocket expenses would be less if they were to do an office-based procedure rather than a hospital-based procedure. And then looking at the recovery period, we usually see patients about 4 days after the initial surgery, and then we see them once a week for a few weeks just to make sure that everything is healing well. But most of my patients, if I operate on a Wednesday, are back in the office by Monday.
That's very short turnaround time to relieve a problem that bothers so many folks out there with sinus issues.
And again, this is truly the result of just advances in technology that we didn't have 20 years ago.
Yes, and what type of results are folks looking at? Can you tell us a little bit more about those?
Sure, there have been a number of studies that have shown that patients who have sinus surgery, by opening up the natural openings, you reduce dramatically the frequency of infections they get. And you also diminish the duration that they might be expected to have an infection. Now that's also going to then mean they're going to take fewer antibiotics. They're less likely to develop a resistant strain of a bacteria and have potentially other side effects associated with antibiotics, which most people would like to avoid. Now, it's not going to prevent someone from coming down with a common cold, and if you've got bad allergies, that's not really going to address that. You know, we always tell people, you know, the only tool you have is a hammer, then everything looks like a nail. The balloon sinuplasty is not for everyone, but it is a new tool that we can offer a certain group of patients, and they can get back to their normal life that they had before they started getting all these infections.
We're now going to meet some patients of Dr. Wall. Welcome, Audrey. It's a pleasure having you on our program.
I'm enjoying being here.
Now, I understand you've been a patient of Dr. Wall's for quite some time.
Since the very beginning, I think, when he came to DC.
And I understand over the years, certainly you've had various treatments done here. In particular, and please correct me if I'm mistaken, Audrey, you had a balloon procedure done recently?
Yes, 2 years ago, I had some kind of infection, and it manifested itself in coughing and sore throat, and he did a number of investigations, and we decided to have the balloon treatment.
Okay, and can you please tell us about that treatment?
Well, I came like 1 o'clock in the afternoon, and I left maybe 4 o'clock, and it was very efficient, and it did what we needed to have done. It made me better.
And when did you start realizing or feeling the results?
Well, I went home and relaxed, and the next morning I could get on my treadmill and run, so it worked out well.
That's very quick, actually.
Yes, it was.
You were feeling a lot better.
I was.
And I take it, obviously, you sound like you're very pleased with the results.
I am.
Was there any discomfort or pain that you experienced with this procedure?
Not at all. I was just happy I was finished with the coughing and the wheezing and everything.
And before we let you go, Audrey, for all the folks out there watching, what would you tell them about your experience with the staff here as well at Dr. Wall's office?
They were very efficient, very concerned, and made me relax, which is what I wanted done.
Absolutely. And on that note, I'd like to thank you for joining us, sharing some of your experiences, and being a guest on our program.
You're welcome.
Welcome, Jeff. It's great having you on our program.
Thank you.
Well, we always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, if I may, Jeff, by asking you if you can please tell us what brought you to Dr. Wall and some of the problems you've had that he's been treating you for.
Well, I've been getting shots with Dr. Wall for many years, but a couple of years ago, I ended up with 3 or 4 sinus infections. So, of course, I came into the doctor, got the treatment, did the antibiotics, but it just was not easing up. So that was why I was talking to him about some other options.
And that option, I understand, was the balloon sinuplasty procedure?
That's right, balloon sinuplasty.
And can you please tell us about that?
Sure, well, what it does is open up very slightly the passages leading to the sinuses so any problems can drain out. And it's a fairly simple procedure. It was done in the office. They give you a Valium, you're very calm. They're pain medications, so there's no pain at all. They put a little balloon into those passages, they inflate it slightly, and that opens up the passages.
And was this done in one visit, or was it over a few?
Just one visit in the office.
Oh, and how long did it take in your case, Jeff?
Well, I think they have you come and let the Valium take effect for a little
Okay.
while. And then it was probably an hour at the most.
That's it.
That was it.
That's wonderful. And how did you feel about the results afterwards?
Oh, it's very good. I haven't had a sinus infection since then.
Well, that says a lot right there.
It
That's very
does.
powerful.
Absolutely. And if I had problems again, or if anybody else has problems along the lines that I described, I'd certainly encourage them to talk to their doctor and see if this is a procedure that makes sense for them.
And before we let you go, Jeff, I just wanted to ask you if you can please tell us about your experience that you've had here, not only with Dr. Wall, but the staff here as well.
Well, they completely prepared me for what to expect, and that is always half the battle. And I had total attention paid to me during the procedure, and leading up to the procedure, they explained exactly what was going on, so there was never any uncertainty or cause for alarm on my part.
Well, on that note, we'd like to thank you as well for joining us, sharing some of your experiences, and being a guest on our program.
Well, I'm happy to do it. I've really benefited from this procedure.
We're now back with Dr. Wall. My goodness, Dr. Wall, the patients have had tremendous results in both Jeff and Audrey's case here today, and others that we found from our research. From the balloon sinuplasty, it's really doing wonders for a lot of folks.
Well, both of those patients were ideal candidates because fundamentally there were not a lot of problems with their anatomy. But when you get to a point where you have a lingering infection that doesn't respond to multiple courses of antibiotics, then you need a different option. And I think both of them, as busy individuals, didn't have a lot of downtime to take off for a long recovery period. And so the office-based procedure was a good option for them. Both responded very well, and both are back to where they were before they started having these infections.
Yes, and in Audrey's case, she was back to normal the next day, she said.
She's a role model for a lot of people.
Yes, she is. And are there any follow-up visits that you require beyond the initial one 4 days after the procedure?
One of the things we do for any type of sinus surgery is we like to see the patient about once a week for probably about 3 weeks afterwards.
Okay.
And that's because the areas inside the nose are so close together that if there's any degree of swelling, they can come in contact. And what you have to make sure you avoid is that any little scabs form or scar bands form, because if you leave that there, that'll close off the areas you just opened up. And so what the patient has to do afterwards is a routine of saltwater irrigations each day, starting about 3 or 4 days after the surgery. And that irrigation helps wash away any mucus or crust or things like that. And then we see them in the office to make sure that there are no scabs that form. They can expect to be back to full physical activity in about 3 weeks. Most of the tissue will be healed within 3 to 6 weeks, but any area takes about 6 weeks to heal back to the totally normal state.
And are the results permanent from the balloon sinuplasty procedure?
Correct. The areas that are opened up will remain open. And this is where the patient selection comes into play. If the patient has multiple issues, in some cases the balloon procedure may not be sufficient. They may still get some other issues down the road. But if you do a careful interview of the patient and review the anatomy, the overwhelming majority of patients get complete benefit that lasts forever, and they don't need any other procedures.
Now, we're literally out of time, Dr. Wall, but I wanted to ask you before I let you go, you and your practice here in Washington, D.C. have certainly established a reputation for excellence, not only in patients' care, but you're also renowned as far as within the ENT specialty in this region. I just wanted to ask you what you feel helps separate you and your practice apart from many of the others.
I think one of the things that separates our office is that we have a very experienced staff, a tremendous staff. The average person has almost 20 years experience working in an office environment, and that helps. We're also a smaller office, and so I think many of our patients are long-term patients. We have a large allergy practice in the office treating sinus allergy patients, and so those patients know us very well. And I think that it's a comfortable environment for patients to come to.
Yeah.
We are affiliated with George Washington University. It's across the street. I do get to interact with a lot of truly brilliant docs over there, and I think that keeps us up to date on the most modern techniques. And that's really what we need to try to do, is really present the patients with the best options available.
So on that note, we'd like to thank you, Dr. Wall, for joining us and being a guest on our program. It was our pleasure having you on.
Well, it's been my pleasure, and I hope I've given you some useful information.